Everyone, it's Lynn McComas, the nurse practitioner owner of Preceptor Link, and I wanted to talk a little bit about how to get your patients to accept a potential student who might be working with you. So this is a topic I get asked about regularly, and I do have a lot of input and personal experience as well on ways to do this. And really, these tips are also useful not just for bringing a student in, but if you're new to a clinical practice and you need to start getting clients, patients of your own, and they may not know you and they might not want to work with you. They already know their provider and you're somebody new. So these same tips can work for this as well. Let's get started. So one of the first things that you can do is keep in mind it's how you present things to your patient. You're in an outpatient setting and the medical assistant were to just pop their head in and say, hey, do you care if a student comes in today? The chances are not going to be as great that the patient is going to really be receptive to that. So it's all about how you present it. So if the medical assistant or the preceptor or somebody else besides the student, because you don't want to put them on the spot, but somebody else, even the front office person who checked them in, if they say to the patient, hey, Dr. Smith is working with a nurse practitioner student today, and he feels like you would be a great patient to meet with. So would it be okay if she comes in and does your history, and Dr. Smith will still be seeing you, but can she come in and talk to you first? That is going to get a much more positive response than the first option. So that's one approach that you might take. Another thing that can work a lot of times, especially if it's something like psych or outpatient or even acute care inpatient. If you say, I'd like my student to do your intake, students are great for intakes. They can get a lot of information and save you some notes and charting, and then the preceptor can look over these notes, and it can sometimes save students the preceptor's time. Another way that has worked for me in the past is when I say, Mrs. Smith, I'd like you to work with my student today, and then I will be in to follow up. So if she can come in and talk to you and do the physical exam, and then we'll be back in together, is that okay? That's typically it's just going to get much more of a response. So another thing that we sometimes recommend is that you have a sign up in the lobby, depending if it's an outpatient practice, and you let patients know that this is a teaching facility for nurse practitioners or med students or PAs or whatever. I've created actually and given a sign to some of our preceptors that says this facility has been recognized by patients and schools as an excellent teaching facility. And we will periodically have students participating alongside our clinicians in your care. So if that's posted outside where everyone can see it, I think it's a compliment to the practice and to the provider that they're so well recognized that they're asked to help teach. So it puts a very positive spin on it. So, and along that line, the front desk or the medical assistant or whoever's bringing patients back, or the preceptor for that matter, can also say that same kind of thing. They can say, our medical institutions, our nursing programs have recognized this practice as a great site for learning, and we do bring students in. Our goal is to help provide excellent training so that we can help educate the next generation of providers. So again, it really depends on how you phrase it to the patient. And if you phrase it in a positive way, in a very positive light, most often they will be accepting of a student. So if there are other problems that you've had, other things that you've encountered in trying to get a student in with a patient, and there's been a problem, let us know and let's brainstorm together how we can overcome some of these so we can help educate the next generation provider of nurse practitioner, of advanced practice nurse, advanced practice provider, whatever. So, all right, let's have a conversation. Keep on learning, everyone. Thanks.